Hi, it's me, Dan. Something a little bit different today. I did a talk last week on Thursday, the 12th of January 2023, to a group of over 20 people, mainly women, who had lung conditions, who were interested in how long COVID could affect them and what we're actually doing as therapists here in Australia. So what I presented was what I'm seeing as a exercise physiologist, patients coming to me, clients coming to me, what they're saying. They're presenting with long COVID or saying that they have long COVID, and my approach to how I treat them and what I do. Also grab a bit of information from the US to see what they're going over there, what health practitioners are teaching health practitioners about long COVID. And also I like to thank Active Health Clinic down in Victoria, who gave me a lot of these diagrams and also some of the information that I have presented on this day. Look, if you haven't already, please subscribe and like my YouTube channel. I post a video every week about health, socks, stocks, shoes and jocks. So if you're interested in any of those, shoes being Jordans, of course. And if you're interested in that kind of content, please subscribe and like this video as well. This presentation goes for about an hour. It's really interesting, got some good information. Also, if you have chronic fatigue, it's good information, or have a chronic condition. But I have focused mainly on long COVID and what we're seeing at the moment as people come into our clinic. Enjoy. See you soon. Bye. Are we ready?
Yes, we are. Thank you.
Very good. My name's Daniel O'Sullivan. You can see up there, I'm an exercise physiologist. This is Sam O'Sullivan. He's also an exercise physiologist. We are not related, obviously. We're not. We are related somewhere down the track in Northern Ireland somewhere, I would imagine, but it's just coincidence. Yes, yeah. Obviously, if he were related and he was my son, because he's considerably younger, he actually would be better looking. So. He knows why I brought him now, just to answer. So I've been an exercise physiologist for probably about 15 years. So it was before actually exercise physiologists actually existed. So normally, if you had a chronic condition, you'd go to a physiotherapist probably. They invented this thing called exercise physiologists. We mainly work in our clinic with people with chronic conditions, including chronic fatigue, chronic pain. We do acute injuries as well, osteoarthritis, arthritis. Everything under the sun. Diabetes, lung conditions, respiratory conditions, all that sort of thing. So I note that this is a lung group, that's correct, yes, and thank you for Chris for inviting me here as well, and it was Maureen, as well. Really.
Thank you for coming.
Yes, no, it's kind of exciting. I haven't been out and about giving a talk for a while, so it's always fun. Sam's been exercise physiologist just for about over a year. Yep. Now, so I'm trying to impart all my knowledge onto him. I've seen people, which is why he's here today. In respect to long COVID, we have seen people through the clinic with long COVID that have come in, and we'll go through it in the next, however long it takes, half an hour or whatever, and we'll talk about long COVID and what we're seeing in Australia at the moment, from my point of view, or from what we do as exercise physiologists, what we're seeing, and then I'll grab a little bit of what they're doing in the US and how they're approaching it in the US, which is a little bit more advanced than what we're doing here in certain respects. Feel free to ask any questions anytime you like. Happy to answer if I can. In terms of long COVID, there are no real experts in this area at the moment. Okay, so there's experts in COVID now, but long COVID, there's no real experts. So we're starting to learn what's going on with long COVID. Has anybody, hands up if you've had COVID? Yes. Another hand up if you've had COVID twice. We're going to use legs now. You had COVID 3 times.
Have you had that or you just indicate?
No, I'm just indicating.
Oh, that's all right.
I've had it once. Sam's had it 10 times because he's in that age group. Twice?
Just twice.
Just twice. Just twice.
And long COVID.
Long COVID. You got long COVID here? Very good. Yes. Okay. Great.
So
Not
have
great.
you actually been diagnosed with long COVID?
So they told me.
And how did you, if you don't mind me asking now, how did you get diagnosed with that?
Just Dr. Lewis, the specialist. Yeah, and I've had
In Canberra here?
Yeah, he's a lung specialist. He's a lung
Yep.
specialist.
And that was through diagnostic imaging, or as in did you have a lung scan, like as in you found embolisms on your lung, or?
Well, the lungs are missing
Yeah,
now,
sure.
obviously. So,
Yep.
And it's just the breathlessness
Yeah.
that
Yeah.
and that's usually when you put it down to.
Yeah.
And it's been going on for over 6 months now.
Yeah, and that changed rapidly after you had COVID?
Yeah.
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 So they actually now diagnosed long COVID.
We'll talk about that.
Oh, we'll talk about
Yeah,
that.
yeah.
I've done what you said.
Yeah, that's right.
Okay.
You turn that record on? Yep. Yeah.
Here we go.
Yeah, we'll talk about that and what's happening at the moment, how things are progressing in that way. So you probably saw this picture. So don't be, if you go to see your GP, don't be the person sitting in the back not asking questions and not really ignoring what's going on, because the person at the front, the GP, could be just focused on one thing. So you really have to speak up and say things aren't right at the back here, right? You're looking at cracks in the walls a little bit too often, I think. Yeah. Poor girl, I always feel bad when I see this stuff. She's not being very happy, is she? How do you identify long COVID? This is what we know at the moment. Long COVID, also known as post-acute COVID-19 syndrome, is a term used to describe the lingering health effects that some people experience after recovering from COVID-19, the disease caused by the coronavirus. These effects can include fatigue, shortness of breath, muscle aches, brain fog, and other symptoms. Yeah.
Brain fog.
There you go. That can last for weeks or even months after the initial infection. So if you actually do a search on Google, sort of this will come up. This is pretty generic at the moment.
So
What we're learning.
will
Yep.
diabetes fall into that?
No,
Why?
because you don't get diabetes from getting COVID.
No, but if you've already got it,
Yes.
it's exacerbated by COVID.
Yeah, have you read my slides in advance? Because we're going to talk about all this.
Right.
We all look from our own.
Yeah. So some of it's going to be a little bit blurry. So how the media explains long COVID, and it can be a bit of a scare campaign, but there's a lot of truth in that. So they'll basically explain long COVID as the same as having COVID at the moment, right? So you may have a recurring fever, persistent cough, respiratory symptoms, chest pain, tiredness, fatigue, aches and pains, persistent sore throat, digestive upset, headaches, chemical sensitivities, loss of taste or smell, rashes, insomnia, sleep changes, and that sort of thing. So at the moment in the media, that's generally what's being said, and that's basically not an acute phase, it's for a longer period. So let's say you're having these things, but for a longer period of time. Would you agree with that, or some of those things? Yep.
That's us 24/7.
Yes. Yep. Okay.
Yeah.
Yep.
We do that every day.
Yep. Yep. Yep.
So it's actually quite difficult sometimes with a lung condition to work out whether you've got the COVID or not.
Exactly.
I had
Yep.
this trouble when all my family came down with it because
Yep.
I've been dealing with most of these things for,
Yep.
you know,
So if you're dealing with most of these things already, it's a bit of a mix up of of what's going on. Yep. And this is the problem with long COVID. So basically, when we see someone that says they have long COVID, we've got some sister clinics down in Melbourne, and we basically did a brain dump of what their symptoms are and what they describe. And these are the words that came out of that, and we put it into a bit of a diamond. So you could probably relate to a lot of the stuff. You can say, sorry, it's a bit blurry, but you could relate to a lot of the things. There's a lot of different words in there that would describe probably actually how you're feeling at the moment with the condition that you have. So all those different things in terms of long COVID. Can you see that, some of the words?
I'm just thinking maybe if you move the table closer, it might clear it.
Yeah, it's only that one. So some of the words are there. There's memory, sadness, anxiety, headache, weight, swollen, concentration, dizziness, confusion. Yeah.
I just saw tinnitus. Does that come from long COVID?
Which one?
These are
Tinnitus.
reported symptoms.
Yeah. This is from people who've had.
They've had
Yeah.
it before.
Yeah.
They get it.
Yeah. These are words from people who've had long COVID. It's a bit of a brain dump. Write down what you're feeling. Yeah.
That's interesting because I've had trouble with my eyes a little bit.
Eyes.
And
Yeah.
I never put it down.
Yeah. Yeah. I mean, it's not the same for everyone.
No.
But I mean,
Well,
Yeah.
as I said, there's lots that I don't have, but
Yeah.
it's funny that the eyes are there.
Yeah. Might be. Maybe. Yeah.
So you can actually put, if you're having trouble with your eyes or they've been macular degeneration and it seems to be exacerbated, you can put that down.
Yeah. Yeah. We'll talk about that. Yeah. We're only allowed 3 questions per talk, by the way.
I'm sorry for that.
I'm joking.
Per slide.
Per slide. Oh, per slide. That's okay. So the question is, why do some people get long COVID and not others? If you've already had COVID in the room, why don't you have long COVID now? And if you look back to the previous slide, you're going, hang on, I have got some of these things that maybe I didn't have before, so there might be a little bit of long COVID going on there. You might not realise it, that the COVID is actually still affecting your body.
What's costochondritis?
So that's an inflammation of the rib joints.
Oh, okay.
Question.
Yes.
Given that the virus affects every cell in your body,
Yes.
that's not at all surprising.
Correct. Yes. Yeah. Exactly. So it's going to, depending on, we'll look at it in a minute, depending on your predisposing factors, how it actually affects your body. Yeah, what's actually going on. So again, sorry, a bit blurry. So we relate COVID at the moment, long COVID, to an invisible illness. So you can't do many diagnostic tests. Long COVID is a condition of elimination. So you'll go to your doctor and the doctor will start eliminating things. Lung conditions, heart conditions, balance, and so you'll see a cardiologist, you'll see a lung specialist, you've already seen lung specialists, they'll eliminate MS, Parkinson's, so it's a disease of elimination. So you're going to go, if you said, I think I've got long COVID, you're going to take your GP is going to take your blood, they're just going to try to eliminate things. It's a disease of elimination. That's the same as chronic fatigue, fibromyalgia. Some of you might have fibromyalgia in the room, might have chronic fatigue. So you can't actually see it. It's just basically over time, chronic fatigue is just you're really fatigued, you can't get out of bed, you have brain fog, that sort of things. We see people like this in the clinic quite a lot. Fibromyalgia is more of a pain sort of sensation. You don't know where it's come from, but it increases over time and you can't really measure it. Okay? Predisposing factors, everybody has these. Like Sam over there, you might have genetics that are not real great, not be really attractive. You have epigenetics, which it means your behaviour and your environment actually change your genetics over time. Mast cell disorders we'll talk about in a minute. Autonomic or blood pressure dysregulation, a lot of you probably have that in the room. Your blood pressure's not well managed, and I've had that for a while. Hypermobility disorder, especially chronic fatigue, you can be really hypermobile. Girls in their teens are really like that, and they can get chronic fatigue. Thyroid issues, a lot of you probably have thyroid issues. Adverse child events, and There's a few things that might be triggering in this for you if you've had a bit of a trauma over the years, so I'll just warn you of that. History of trauma, personality types or traits. You could be just someone that just, you look at someone and you catch whatever they've got. You don't have to be in a close proxy. You could be one of those person that actually catches everything, right? You're the person who always gets sick. Or you could be that person that never gets sick, that suddenly gets sick. You could be that person, right? Mental health conditions, of course, lifestyle factors. You just really lead a really crappy life, as in terms of you don't look after your body and so forth. In terms of that, there's probably always someone that we know, probably more your generation. So we've got 3 generations here. We've got sort of this generation, and my generation. We've got Sam, who's like 25. A lot of smokers in your generation. Not many in mine. Have you got any friends that smoke?
Not really, no.
No. So it's becoming less common now, but there's that sort of person that smoked all their life, drank all their life, and they're perfectly fine. And just like, okay, not perfectly fine, but nothing adverse has really happened to them. They're still going on. Yeah, don't have that. That nothing really affects you. Central sleep disorders, you're just a person that can't sleep. It's always been like that. Food intolerances, which can change over the years. Other health conditions like diabetes, and so forth. So we all have something going on here, right? We always have something here, something is all in the background. We all have some sort of genetics, and you can get by in life pretty well with these kind of things. You have trauma as a child, but you can be okay, right? Then we've got this precipitating triggering factors that happen. Okay, so in chronic fatigue, we're just talking about chronic fatigue and that sort of thing at the moment. You can have a severe infection, you can get something, Ross River virus, something like that, which actually will trigger something over here that makes it worse. You could have an emotional stress or trauma, you could have a car accident, something like that, which will trigger something over here. Significant injury, concussion if you have a fall with a blow to your head, even at a younger age, playing football or whatever. You can have a significant life event, you get married, you get divorced, you could have a kid, you could lose a kid. You could have unmanaged medical conditions, things that doctors just can't get on top of. So that's what we call triggering events. So you can have one of these that actually makes your mental health condition worse. That was okay, but something big has happened and now it's affected this. Does that make sense? Yep. So you're a bit older than what I am, so this may have happened to you. You could have, what else you could have? You could have had a significant life event and now your sleep is a lot worse. Yeah? Makes sense? You're wondering, how do you relate this to COVID? I'm getting to that. So we go the down arrows there. So we get an overload. When something happens, the triggering event happens to something that's predisposing. We have an overload of stress. And this goes in a vicious cycle, right? So we have this overload stress. And your generation, so you're a little bit older than me, you're a generation of push through things. You just push through. Is that right? When you were brought up like that, I feel. Like to push through, not so much now, because we know better, but to just push through and get on with it, right?
I think more the males of our generation did that.
True.
They were meant to be tough
and
handle things.
Yep.
Women tend to be a bit more pragmatic because we're the people aware of, our children's health is not well. We tend to be more practical, and if there's something wrong with us, we go and fix ourselves up because if we go down, our children go down, the family goes down.
Sure.
Doesn't matter how strong the guy is. That's more our generation.
Yeah. But were you a bit more pushed through than what
No,
my generation was?
Practical thing and went to the doctors if I had been an issue.
But we call it the boom bust cycle. So you try and get on with stuff, right? And you do too much. You don't know. You can do too much, right?
Yeah.
You can do too much, and then you get stressed again, and it's a vicious cycle. You avoid aggravating features. So just say if you've got a sore hip, you keep pushing on, you keep walking, it gets worse, hip gets worse, and so forth. too much or too little rest. So suddenly you're in a position where you actually you want to stay in bed more because you're tired, even though you should do things, and that can be a cascading effect of more overload. Unresolved perpetuating factors, maladaptive coping strategies, which would be drinking, perhaps is a common one, drinking alcohol, and disengagement from meaningful activities. So if one of you here was starting to get a lot worse in terms of symptoms, you might not turn up to the group anymore, and you've got a group, so someone here would ring this person and say, where are you? And say, I'm not feeling well, and you've probably all felt like that anyway. But it's this sort of cycle that goes around. If this gets too bad, you get sensitization to it, which means it becomes a bit more normal, and you basically have an onset of chronic illness, which we can lump sort of long COVID into as well, where you're fatigued, you can't get up, you can't move, and so forth. So it's a big spiraling sort of stuff. If we go back to this, so now I'm going to associate it with long COVID, okay? Exactly the same thing. We've got all these predisposing. This doesn't change. How does this change? What do we add to this side? What's the...
All those things back in the previous diamond.
No, what's the triggering factor? What's it? Yeah, COVID. Right, COVID's the triggering factor. So we're getting COVID, right? That's the triggering factor of this, right? So you've got something here, and this is the trigger. And whether it's going to trigger it or not depends on the person and what you've got going on. You can have very healthy young people that get COVID as a trigger for something that's going on here that was underlying, whether it's just your genetics or whatever. Make sense? Yeah. Is there something else there that we can add to this whole COVID thing as a trigger?
Stress, isolation.
Yep, there's stress isolation, yes, but just in regards to COVID. Anything else?
Yeah, the uncertainty.
Yes.
We've gone through 3 years of shit, a lot of people.
Yep.
We're into the 4th year.
Yep.
And I would question whether calling it long COVID is a sensible name.
Sure. What would
That's
you like to call it?
question.
What do you want to call it?
Post-viral malaise, post-viral conditions.
Yeah. And that's what it is.
Because long COVID, to me, assumes that you've still got the symptoms of COVID.
Yeah.
And in fact, you may have some of them, but you don't know whether you've still got the virus or whether you're getting it again.
Yes.
And I'm very disturbed by the fact that there just doesn't seem to be much good information.
Yes. Yeah. Exactly.
Anyway, that's...
Yeah. And that's what I'm talking about. COVID's the trigger, but it's affecting this. It's making this side worse. So COVID's no longer the issue.
No, it's that side.
It's this side.
And the other thing that I found is that some people get COVID and 2 days later they no longer have symptoms.
Yeah.
And they don't believe that somebody, what's the matter with you?
Yes.
Because I was over it in 2 days.
Yeah. Exactly.
So there's not enough good information, and I don't think that the medical profession are really on top of it either.
Yeah, agree. And this is why there's no experts at the moment.
That's the case with most viral infections. No two people get the same reaction to any virus in the past. So COVID's not going to be any different.
Yeah.
And the recovery time, exactly the same. We can get cold. Some people can be over it a couple of days. Some people can still have it a week later.
Yeah.
It all depends on predisposing factors, doesn't it?
Yeah. Same, similar to Ross River virus, things like that have ongoing problems with that.
Long COVID is immediate term, isn't it? Isn't that where it came from?
Yeah, sure.
Yeah, so there you go, that's the reason for that.
I'm interested in a way that why hasn't there been much discussion about similarities between post-long COVID,
Yeah.
by whatever sort of taxonomy you want there, and glandular fever.
Yep.
Glandular fever was around when I was a teenager, when
Yeah.
I got it, and it was a minimum of usually 6 to 8 weeks, but it could go on for months. And then you needed another 6 months minimum to become fully strong.
Yeah.
I mean, why does that one get lost off the list or not even mentioned?
Yeah, I mean, it's probably covered here in severe infections of viruses. It has the same effect on predisposing
Yeah, it's a
factors.
similar sort of effect,
Yeah.
isn't it?
Yes,
Yeah.
no, I'm just curious because I think there could be a bit more widespread understanding
Yeah.
of glandular fever in terms
Yeah.
of the varied response and particularly the mental health side.
Yeah. Yeah. Certainly glandular fever, we see quite a few people, especially young women with glandular
Yes.
fever that get
Yes.
chronic fatigue afterwards.
Yes.
Very common, very common. Even some guys. But I'm sorry, I will answer these questions and I'll explain it more as time goes on. Sorry, one more thing. We haven't got to this. That was a good. I like that, but there's one more thing. Sorry.
Tell us.
What did we get in our arms?
Inoculation.
Yeah, your COVID vaccine, right?
Adverse reaction.
No, your COVID vaccination. So COVID vaccination can increase these predisposing factors as well. Okay? Yeah. So,
Sorry, increase or decrease?
increase. Like it can affect these predisposing factors.
Okay, right.
COVID, yeah, and we've had ours. We've had our. You probably all had 4, have you? 5, yeah. We've had 3. So I'm not saying I'm against vaccinations, but that it can trigger. It's a trigger for predisposing factors. Because I've definitely got people who came in. I had a guy last week, and I was treating him. I've been known him for about 4 years. He had COVID injection last year, dizziness, falls, hasn't been the same ever since. So injections can be a trigger as well. So I'll go through which was where Chris got my details from, where I talked about COVID. I sent emails out every week, twice a week actually, and one of them was on long COVID. So I think this is where you read that, and it's like, yeah, it's pretty interesting. 50-point list, the next steps you think if you have long COVID. It's adapted from a doctor in America called Claire Taylor, who works with more people who have got long COVID. So obviously, bigger sample size over there, people. And as I mentioned earlier, to diagnose long COVID, your doctor will use a process of elimination. Blood tests, scans, so you'll go through all those things. If you say you think you've got long COVID, your doctor will do that, which is probably the normal stuff you're getting done anyway with your GP regularly. So number 1 is find the clots. So apparently in the US, they are there, if not pulmonary embolism or DVT, deep vein thrombosis. Anyone had a DVT before? A DVT, a deep vein thrombosis? Yep. Microclots as well in the lungs, which are not easily identifiable through scans. Apparently, 100% of all long COVID patients tested so far have them some sort of clots in their lungs. Okay. Now, I was talking to someone about this last night as I was going through it, and she's a smart person because she's my wife, and she said, hang on, if you're not normally measuring microclots, then a lot of people could actually have microclots in their lungs just through flying. If you've been over the world, you can get clots in your lungs from being on an airplane and that kind of thing. So you can get through life with microclots, probably. So even if you get scanned, whether they were there in the first place or they've come out because of coronavirus, because of long COVID, because of COVID. I don't know.
If they're finding 100% of all long COVID patients tested so far have them,
Yeah.
There must be some sort of test that does show microclots for them to be able to make that statement. So what sort of test or scan is done to do that?
Yeah. So if you don't find pulmonary embolisms on a CT pulmonary angiogram, you've probably all had these, have you? Let's say this group? No, some of you? Yeah. Ventilation, perfusion or dual energy CT, you'll find the missed clots. So basically, I did a little bit of research. Can't find a lot that do a lot of lung scans in Canberra. I might be wrong.
They do the few scans if they suspect you've got a PE.
Yeah.
If there's any casualty, it'll be the first thing they have a look at after a chest X-ray.
Yeah.
My experience.
Okay.
Yeah.
Did a bit of research, St Vincent's Hospital, and they have a lung division. Anyone been there? Yes.
They're fantastic.
Yeah, okay.
Is that St Vincent Sydney?
Yeah, St Vincent's Sydney? Yeah. So they have all this lung scanning stuff. So if you were concerned, don't be the little girl at the back of the bike, in the back. Ask your GP if you can get further referrals. Ask the question. You could be from the generation that doesn't question your doctor. But there are a lot of doctors that are a lot younger these days, right? There are a lot of doctors that are in their 30s and 40s that don't mind being questioned. So this was the best, the closest probably, St Vincent's lung, and you can look it up online if you want. They do all the tests there to try and find the clots. Yeah.
Canberra has a nuclear scan.
They do, yeah. They must have it. Yeah. You have one, yeah. They might go a little bit deeper here, a little bit more sensitive maybe. Yeah, to see the little microclots. Yeah, so something to think about anyway. Yeah. That you could. I'm not sure if that covers on Medicare or probably does, being your age. Yep. But then you've got to get to Sydney. Yeah. You can test for autonomic dysfunction. So COVID really likes playing around with the autonomic nervous system. It really likes playing around with your blood pressure and you sort of the things that work in the background. It really loves sort of playing around with that. We do a bit of a test. We haven't done one in a few months because we haven't needed to. But you can do a standing test and then a lying and then a standing test. So basically you lie down for 5 or 10 minutes. We take your blood pressure after about 5 minutes for a minute, put your blood pressure down. Then we do it a minute later and hopefully they're about the same if you're lying down. Hopefully, so we keep doing it until you get 2 readings that are about the same, including your heart rate as well. So you're laying down for about 10 minutes, take your blood pressure twice. We then get you to stand and you lean your shoulders against the wall, feet away. You stand like that, we put the blood pressure cuff on and we take your blood pressure every minute for 10 minutes. What we're looking for is a change in blood pressure, a change in heart rate. So what can happen if you have something like POTS, which is postural orthostatic tachycardia syndrome, it means your blood pressure drops and your heart rate goes up. Okay, so it's a compensation thing. So if you're at the dishes and your heart rate's going at 150, or if you feel like your heart is racing, you may have something like that. Maybe a bit different for this group as well because you obviously have lung issues as well. So your heart rate can increase because of that as well. So that's a test we do in the clinic. If you've got a blood pressure monitor at home, you can do it at home yourself. But just mind if you're actually taking your blood pressure every minute there and you're starting to feel faint and fatigue, it's probably not good. You probably should sit down and not do it.
When I've had my blood pressure taken by doctors and
Yep.
in the hospital, they always ask me not to have my arm down, but to put my arm out like
Yep.
this, or to rest it.
Yep.
So you were saying up against the wall, you put a cup on.
Oh, look, whatever's
So
convenient.
that actually
So if you're like this and you've got your arm out, you could hopefully have it resting on something so your arm is rested.
So you do it on
Yeah.
a more horizontal position.
Yeah,
rather
you just
than-
your arm there
because you
resting.
had your arm down like that, and I thought, well, that's going to negatively impact on your blood pressure
Yeah.
already.
Yeah, as long as it's consistent every reading.
Okay.
Yeah. So that's testing your autonomic nervous system. We find this, again, in invisible chronic illnesses, including chronic fatigue. It's a condition called POTS, or orthostatic intolerance. It's quite common, and we're seeing it more in people that have long COVID, affecting your blood pressure, which makes you dizzy, which has a problem of falling, and so forth. So that's just basically the practical side of it. I was just showing you that. I was thinking about doing it with someone here, but it would just take too long. Then you treat the autonomic dysfunction, and treating that would be going to see a cardiologist and investigating that a little bit further. If you do have something, if you are getting dizzy, or you find that your heart rate is racing, or blood pressure going up and down. I talked a little bit about mast cell activation. So it can be a predisposing factor. So mast cell activation, it's a thing where you have your white blood cells, and basically you can come out in a rash. You have the symptoms here: stomach cramps, diarrhea, difficult breathing, anaphylaxis, things like that. And it seems to be triggering, COVID seems to be triggering mast cell activation as well. It also, the vaccinations for COVID can trigger this as well. It's quite common. Not quite common, I should say, but I've seen it quite common because the people that come in to see us have a lot of them have chronic fatigue, and when they have the vaccination, it actually triggers this mast cell activation. So how you treat this is basically, before you get your vaccination, these girls, what they're having antihistamines, taking antihistamines, and also anti-inflammatories to counteract this. It's basically, if you dermographism, if you scratch yourself like that, it comes out of a big rash. So really sensitive. You don't need any fancy tests for that, just treat it with antihistamines and anti-inflammatories. This is a big one for us, for Sam and I. When I present these, this is a health professional talking to other health professionals. So I'm giving you the insights of what the talk is going on between us as health professionals. Exercise is not going to cure long COVID.
Who said it did?
Sorry?
Who said it did?
Well, we prescribe people exercise. So we're telling each other that we're making sure that if someone comes in long COVID, I'm not going to focus on, you've got to exercise, you've got to exercise, you've got to exercise. Health, exercise is the best thing for you, right?
So exercise.
You've got to keep the job satisfied.
Yeah, I got to keep the job. I don't really care. I don't pay this guy. But there's ways around it, and we'll go into that in a minute. But this is, 70%, this study here, 74% of patients felt worse. So there's still 25% that actually got benefit from the exercise. Exercise is important for other conditions, right? So it's a balance, it's a balancing act. Don't tell people it's psychological. They have been affected with a level 3 biohazard with unknown repercussions. Okay? So someone says, I think I got long COVID. Yeah, don't tell them it's in their head. Just because you can't measure it real well, it could be true. Yep.
Is long COVID something that people will develop shortly after they've had COVID, or can there be a gap?
The question was, can long COVID develop shortly after you've had COVID, or can there be a gap? Don't know. Could be either.
So it's possible later?
Yep, possible later. Yep. And I'll talk about that a little bit more in a minute. This is, again, professionals talking to professionals. Don't tell them to think themselves better, to try harder. They're already trying. So if you've got a chronic condition, you're actually, you live with a chronic condition, you're always trying to better yourself. So we don't want to tell people just to try harder. So this is where the main thing comes in. We advise them on pacing. And with people with chronic fatigue, chronic illnesses, it's all about pacing. way of using what energy is available without crashing, so no boom or bust kind of thing. So if you find yourself you slowly can't do as much as you did a month ago, then basically you have to realise how much you can do during a day without crashing the next day. Work with that for a while and then try to slowly increase on a percentage basis over time. Just try to do a little bit more, but pace yourself. Especially lung conditions, I suppose you can have a big event, you go out and you just feel really fatigued the next day and the day after. Especially with a lot of chronic conditions, that can be the case as well. So it's a matter of pacing. So we talked about post-exertion malaise before. So that's definitely a thing. You do too much and then you're just wiped out for the rest of the week. So we basically, instead of teaching people to do exercise, we need people to pace themselves and to manage that. That's our job in this instance. So if you come to us and say, I think I've got long COVID, I'm getting really tired, I'm sore and whatever, then we'll try and take you through a pacing kind of thing. And say, okay, what can you do now? And then do that for a while and then we'll ramp it up.
Are there degrees of severity of long COVID?
Yeah.
Because something may just be, when I say may just, but some people may in fact only have shortness of breath on exertion more than they ever had,
yeah.
and it's not related to their lung disease, it's
yes.
related to something further.
Yeah.
So when they tire earlier in the day,
yeah.
they may not necessarily crash the next day.
Yeah.
They may still doing shopping, but it knocks them out a little earlier than what they would have expected.
Yeah.
They may not be able to lift groceries as they used to.
Yeah.
And it's not something they've experienced pre-COVID.
Yes.
And yes, we're all getting a little older and we might see some things happening.
Yes.
However, I've had COVID twice and I can tell you it took me 3 months to get over the first bout.
Yeah.
And I'm still recovering from the second one with varying degrees of symptoms.
Yeah.
I don't crash every day and go to bed, but I can tell you I'm buggered at the end of the day.
Yeah, yeah. Yeah, and generally in the past we would have put it down to getting old. Just getting old, and I hear that every second day in the clinic. Just getting old. I'm like, really, are you? Yes, you are, but it doesn't have to be like that. But yeah, and that's really hard to measure because everyone's different, and we talked about the predisposing factors, so that's going to intertwine with that and how it affects you somewhat. And then it's really hard to go to your doctor and say, I feel okay, sometimes I can do the shopping and sometimes I'm not, sometimes I'm fatigued, but how do you measure that? How do you measure that over time? So.
Yeah, and this is where it's sometimes difficult to get the medical professionals to actually listen to you and believe you.
Yeah.
I went to my GP and I said, I don't have any energy, I don't feel motivated.
Yeah.
And he said, you're one of the most motivated people I know.
Yeah.
And I said, I'm telling you, I'm different.
Yeah. Yeah.
So what Val has described, could be aging, but it's more extreme.
Yeah.
And we know our bodies better than, and you want to be believed.
That's right, yeah.
And putting things down to aging, that's just a universal cop-out.
Yes, yeah. But it's used by your generation a lot. It's used by it's used by humans.
It's been used
It wasn't just our generation.
Yeah, no, I'm sorry. I was and then I thought, hang on. I had a 25-year-old yesterday who said, I'm just getting old, my ankle.
Well, when it comes to, 25-year-old athletes can be 100 years old when it comes to joints, but we need to move away from short-term, from the aging bit as an umbrella, to radical changes when COVID is around.
Yeah.
It's just, obscuring the real problems for long COVID.
And you want to be believed.
That's right.
Or it's used to shut you up.
This is the problem with individual medical practitioners as well.
Well,
It needs
it's age discrimination.
it needs to be a team process as well.
Yes.
So if you go to a GP is like, ideally your GP should refer you on
Yes.
to someone that has more interest in it. And it's like, okay, this is happening to Betty down the road. She's having exactly the same as what you're having. This is what we're doing for her. She seems to be going all right. So it should be a multidisciplinary effort on medical, and that's what we're trying to do. That's why I'm trying to liaise with GPs all the time, saying, hey, we're seeing people with long COVID. Do you have people with long COVID? And they're like, yeah. Like, what are you doing? They're like, oh. Like, yeah. It's like, well, send them to us and we'll help them out. We'll do our best. We'll give them some ideas. We'll point them in the right direction. This is what we're doing. And a lot of other places are doing that.
For those of us who are in this predicament, having had COVID, and because of, for whatever reason, chronic conditions take a lot longer to recover.
Exactly,
and to have those symptoms dissipate to the point where they're no longer coughing every morning, where they can do a little more. So after the GP has dismissed you and charged you twice, because you've gone over 10 minutes and achieved very little, where is it that we who are in a predicament like this, where would you recommend people go to? And I can see you put your hand up and say, come to me. But for the progress of getting well, where do we then go to?
Are you talking directly in relation to long COVID?
Yeah. Basically.
You ask your GP, do you know someone who is seeing people with long COVID?
Okay.
And the GP will go, oh, no. Can you get on Google and do a Google search for long COVID Canberra and see what comes up? And see what practitioners come up? Because that'd be really good.
But then the long COVID clinic has over 6 month waiting list.
Well, that's public. Yeah, so there are clinics that are looking after people, so they're private. You can get Medicare rebates $5 a year, you can probably know about that. We bulk bill, which is not much, but it's see someone, get a plan, go from there. A lot of exercise physiology clinics around now will, physio clinics will have that sort of thing as well.
Yeah, so go to an exercise physiologist, but don't eat, because you can have one or the other. I'm saying, as I said, in terms of, do you use a Medicare health plan? Yeah.
But you just said that exercise isn't too good for long COVID.
Yeah, I'm an exercise physiologist, and as I said earlier, we're developing a plan for you to pace and work out what's going on. We have a more general interest. We're going to listen to you and say, okay. Yes. And we've seen people that have long COVID, so it's just like, yes, it's real. This is what other people is doing. Why don't we try this? Why don't we make a plan for that? That's what we're saying.
Yes.
You've got to pay to go through all of these tests to find out you've got long COVID before you start all of that.
You've got to go through the process of elimination, but even if you don't want to do that, you can still question your GP and just say, is there anyone around that specialises in long COVID or viral infections?
And so if there is an answer with exercise physiology, where the most of us here can get a long-term chronic health plan,
yes,
and there is an opportunity to use your 5 selections to pick one of the 5 people, which could be an exercise physiologist, to gain some information about how to go about looking after yourself long term. Do you, I'm not asking you to identify them personally, but there's a group of exercise physiologists here in Canberra that will take this on underneath the Medicare plan.
They all should.
Without paying gap fees. You see, there's, that's
up to the individual business.
Yeah.
We bulk bill, sorry. So
Okay, thank you.
we bulk bill. And I come from exercise physiology bias, obviously, because that's what I am. But I think it's just someone who has an interest in long COVID, whether it be a physio or exercise physiologist, a dietitian. But as everyone know about the Medicare plan, the healthcare plan, so you have 5 sessions a year. There's a lot of misunderstanding with it as well. It covers, so you get 5 sessions a year on Medicare, okay, for allied health. So it could be dietitian, speech pathology, physiotherapy, exercise physiology, Aboriginal health.
Podiatry.
Their conditions, yeah, podiatry. And you can only use 5 sessions amongst all of us. So it's not much, right? Nothing fixes anything in 5 sessions. Right? It should be more. It should be 10, 20 sessions.
And you actually, unless you go to a bulk biller place, there is quite a gap between the Medicare rebate and the total.
Yeah, so you get your 5 sessions. So as exercise physiologists, we get paid $56 to see you under Medicare. Okay, so if you come in, I'll see, because they're only half-hour appointments, I'll see you, I'll bulk bill, I charge Medicare $56. Okay? Some business models say that's not enough for half hour, so they'll put a gap on it. They'll charge you $20, $30, whatever, $40 on top of that for that visit as well. We don't do that. We just bulk bill the $56.
One comment for people using the GP management plan for the first time. If you don't get your doctor to do the paperwork up front, you can't claim a rebate for Medicare later. So that's crucial.
Doctors, depending on the GP, like a lot of doctors have referred to me, they do it on the spot. Their patients get it done on the spot. Other GPs will send it to the clinic nurse. They'll go through a whole rigmarole of stuff, which can get audited. So that's why they do that. The GPs that send me, they just do it on the spot, just write it out and give it to the patient, and they come and see me. And basically, once that's done, I bill Medicare direct, so you don't touch anything. I just bill Medicare direct. So it makes it as easy as possible.
Can I ask, is it always through a referral system from your GP to see an exercise physiologist?
No, you can go privately. You just look someone up online. You can go, I want to see this person. Yep. You just Google. Google's great. Or word of mouth.
But then you're not bulk billed. You've got to pay for it.
No, you're not bulk billed. Health insurance. But you're not bulk billed. But then what we do, if someone comes in a chronic condition and they've come in and just found me online, I'll go, have you got a care plan? And they'll go, well, what's a care plan? And I'm like, okay, this is a care plan. Next time you come in, the government will pay for you. You've paid your taxes, the government will pay for you to have a session. Let's do that. Do you want to do that? Okay. Care plans only go from January to December as well. Okay? So you can only have 5 sessions from January to December. Your calendar year. GPs forget this, and you can get that done any time of the year. So usually we try and use up people's sessions before the end of the year, so we get your fresh 5 in January.
But another issue about that is that at the point that you get the initial management plan, you have to specify how you're going to allocate those 5. And so it's a bit of a taster.
It is.
And
sure.
then you might find that you go to a dietitian who is useless as far as you're concerned, because you've been it's been suggested, well, spread the 5 over these various health professionals. And then you go to an exercise physiologist and you think, this is just what I need. But then you're into paying yourself. So, it's very hard to sort of manage some of these things.
I mean, the repeat people that come back and see me year after year just have the 5 sessions with me, with us. So they just come back, they're 5, and have their 5. So technically, the government requires you to get a care plan. You have to have 2 chronic conditions, and you have to split it amongst 2 allied health professionals. The GPs that send me just send them 5 to me. if you're happy to do that, then I'm happy to do that.
But that's okay if they've only got the one thing, but if you've got more than one, you have to choose who you want to go to.
Yeah.
I'm on the plan and I belong to the Daniel, but I don't explore that. I can go back to the doctor and say, well, I want now a dietist or I've got this issue.
You can change it.
Another referral in that 12 months. Like,
Yeah.
I don't have to have them all at once. I have
Yeah.
monthly new ones.
If you've got an aged care package, you can get these things through it too.
Oh yeah, aged care package is a whole nother thing. I mean, we can get a lot more on aged care package.
Well, I would assume there's some people besides me that have got an aged care package.
If you've got an aged care package, we can come to your house. Yeah, we definitely can organise something and come to your house. You can come to the clinic. We can do whatever.
So what's the difference between you and a physiotherapist?
Oh, good question. You used up all your questions. You used up. So physiotherapist traditionally was more acute injury. So you sprain your ankle, you do your knee, you do your neck. You go see a physio. Generally, in the first 6 weeks of injury, you'd see a physio to get you back going. They've expanded their business model to see more chronic conditions. Exercise physiologists, we just work with chronic conditions mainly. A little bit of acute stuff, but mainly chronic conditions, which is a lot harder. We spend more time with people. I'm a little bit different because I do soft tissue work as well and massage. I do massage. So I do a little bit of both. I do exercise and hands-on stuff. Traditional exercise physiologist does exercise and planning and management sort of thing, but doesn't really do hands-on. Yep. Whereas I can do hands-on as well, which is a good combination. I'm trying to get this guy to do hands-on as well. Anyway, let's continue. We're still going. We haven't got much more to go. You're doing well. Don't dismiss chest pain. This shouldn't even have to be said, but unfortunately it does. 19% of long COVID patients in this study had myocarditis. So carditis, almost 1 in 5, so treat it. It's not anxiety. So get chest pain, see a cardiologist, see your doctor, okay? Make sense?
Which is inflammation.
Yes, myocarditis is inflammation of the heart. Which was really publicised in the media early on when you had your COVID vaccination. It was happening to a few young people. And we had a few people that came in that actually had it. Try not to catch COVID.
Try.
Yeah, between 1 in 10, 1 in 20 chance each infection as it accumulates. Damage is likely to be cumulative. It affects all organs as every organ has a blood supply, as we talked about. Just try not to get it in the first place, if you can. If you do catch COVID, especially your age group, take antivirals within 5 days of symptom onset. Okay? Makes a huge difference, antivirals. Yep, so try to get in your antivirals. Our age, we're sort of not, we don't qualify. But generally, I think if we want antivirals, we have to pay $1,000 or something.
How much?
1,000? So they don't give them out willy-nilly. So you have to be over 70, you have to have couple of chronic conditions.
Have to be over 70.
You don't wish your
I'm
life
not
away.
quite there.
No, not quite there.
So I can't get them. I have to pay the $1,000.
No, if you have a chronic condition, or
Yeah,
you could probably talk your GP into it if you've got a good GP.
I'm not saying to catch it, but if I do.
Of course.
In Victoria, they don't.
Oh, okay. Yeah, didn't know that.
No, you have them in the cabinet.
You can go on a holiday and go to the doctor and get a script to take.
I would suggest that as well. If you have any overseas trips, I would take your antivirals with you. Yeah.
If you don't have symptoms, then you can subscribe or something.
Yeah.
Wow.
Talk your doctor into it.
Except, how do you know that particular antiviral is going to be effective against the variant you have?
Don't know.
Roll the dice.
better than nothing.
Also, don't think because you felt okay after one infection, that'll be the case after 5 infections. You may be okay after a couple, but after the next one you may be really crook and so forth. And we can't get long-term immunity to the virus no matter what anyone says. Again, this is a US-based thing, so the virus is changing, that's basically what they're saying. So you may think you have immunity and you may get it again, you might be okay, but then a new strain just slightly changes and you may get sick. I thought saying that you're immune is certainly not really a thing.
Well, that's the same with colds and flus, isn't it?
Yeah,
It's every virus.
Yeah, every virus. But, I mean, you get COVID and then you're sort of immune for a short period afterwards, I think. Don't listen to people say it's a cold. It's not. It's really, really not. Colds don't cause organ dysfunction and blood clots. And of course, protect the children from all the above. They will be the next generation with early heart disease.
That's the scary.
Yeah. This is something that we use in the clinic, and sorry it's a bit blurry, but we're trying to identify, and the question was when you go to an exercise physiology clinic or when you go to someone who is involved in invisible illnesses or now long COVID, is we go through a questionnaire. We colour code it because it makes it really, really striking. So we get to tick your symptoms, and if you can't read that, at the top it says mental fatigue. This person is ticked. Next one is physical fatigue, they've also ticked. Concentration difficulties, headaches, sore throat, tender glands, joint pain, muscle aches, pain, shortness of breath, loss of taste or smell, fevers, temperature, bloating, diarrhea, constipation, unrefreshing sleep, dizziness, sensitivities to light or noise, difficulty standing, coughing, sweating, and salt cravings. So you go through that, you tick what is appropriate to you. So this person's ticked mental fatigue and physical fatigue, and we relate, the yellow section we relate to fatigue. So we're going to have a bit of a fatigue bias in terms of, you've got this virus now, it's going on for a period of time. We're going to have a look at how we can help you with the fatigue situation. If it's predominantly green, it'll be pain. So we're looking at headaches, joint pain, muscle aches as well. So we have to address that. How do we address that? OI and POTS we talked about earlier, or static intolerance, which basically means you're getting dizzy and your blood pressure's being played around with, and your heart rate as well. So the blue for that, that's that blue there. So that can alter your temperature regulation, your sensitivity to the heat, and also be nausea, diarrhea, dizziness, that sort of thing. IBS gut issues, so that's in the red. So we're looking at nausea, bloating, diarrhea, constipation as well. If that was a predominantly thing, someone ticked a lot of those, we would probably look at sending you to a dietitian, more than likely if you're sort of in that area. As well as, you know, a bit of this as well, maybe we'd have a look at that. Respiratory issues, which obviously affects this cohort here, shortness of breath, coughing as well, if you sort of generally tick those. Yeah, exactly. So you'd probably tick a lot, you know. So it's just what do we focus on first? What do we concentrate on and move towards? And chronic stress sensitization. So basically you're so sort of wound up, you're not sleeping. It can change the autonomic regulation, sort of loss of taste can actually happen through that as well if you just get on with things. Does that make sense? Something like that? It sort of directs us in a way that we can look at things as well.
What a white POTS is again.
So POTS is postural or static tachycardia syndrome. So when you change your posture, so when you go from lying to standing, your blood pressure drops and your heart rate increases. Yeah.
And OI is the same thing or something?
Yeah.
Right.
Or the static intolerance. So that might not exactly happen, that mechanical thing, but you can't tolerate changing from a lying or sitting position to standing very well, which might be quite common for some of you. Already, protective factors, what can help you? Generally good physical health, varied high quality diet, good sleep hygiene, supportive social circles, like we have here. Perfect, great group. Fulfilling hobbies, interests, mindful practices, and early interventions to health when you're actually younger as well.
One more.
Yep.
Bullet between the eyes. Trust me.
Just a video to finish with, and this is I like this video. It's quite good. Doesn't really relate with long COVID. That's a nice video. We'll watch this. Goes for about 3 minutes. There is an ad right in the middle if it works, so just excuse that. But yeah, it's a nice little video. Any other questions at the moment? Oh, wait. Yep.
You're saying that when people come to you with all these problems,
Yeah.
you assess it, etc., but then what do you do?
So the question is, so as exercise physiologists, we deal with a lot of complex people. There are people that they can't come to the clinic, and we have to go to their house, and they're in their 20s, and they're not like overweight because they can't get out their door. They're basically, they can't function.
Do you give them exercise programs?
So yeah, as we went through earlier, sometimes exercise is not exactly what they're. People want to exercise, they want to move. So our other job is get people moving as well. So there's a difference, I think, between exercise and moving as well. So just getting going and doing something to feel like you've done a little bit. So it might be just a one stretch. This is the difference between exercise physiologists and physios. Physios will give you 20 things to do, right? Like exercise physiologists will as well, but if I give someone more than 3 things, you can't remember more than 3 things anyway. So if I give you sort of 1 to 3 things to do, then you'll do that. But in terms of if someone comes and sees us, it's basically, where are you at the moment? What do you want? Where do you want to be? What do you want to be able to do? I can't go shopping anymore without being fatigued. I can't walk around the mall. I can't do that. Okay, then what can you do? This is what you can do. Okay, let's try and increase your tolerance to and that on a weekly basis by doing something a little bit extra and sort of managing that over time. If there's a painful condition, we will work on that as well. But basically, we try and get your tolerance up a little bit. And yeah. Noting that people crash a lot of the time as well. You start feeling better and then they crash. So we see that all the time. So we have to manage that as well. So yeah, okay, this is okay, but you can still go on. So it's not like you're not going to do 20 push-ups or 10 squats. Maybe 1. You sit down and get back up again. Any other questions? No? Just watch this video. I like it. Gets me a little bit every time I see it. I don't know if you'll actually hear the sound, actually.
How does COVID affect diabetes?
Just give me a sec. Can certainly affect your pancreas. They could actually make your sensitivity to insulin higher, perhaps.
Say that again.
It could affect your pancreas, so your sensitivity to insulin could be higher. So if you're already on medication, if you're already on insulin, you could find that you may need more to counteract that, perhaps, which is a vicious circle, because if you're on insulin already, insulin's a good storer of body fat, so it's a catch-22. So if you need to take more because there's suddenly been a decline in that system, then you could mess around with your metabolic system a little bit more. Can make things harder for you.
It also affects your ratios.
Yeah. Definitely.
Helen, you need to get rapid. It's like an in-between top me up. Like if you get sick and you're down and you're getting really spiky, you need an injection called rapid.
There are three things that control our life.
Sorry. I don't know if you can hear this. This is the only speaker I got, so.
There are three things that control our lives: time, wealth, and health. When we're young, we have time. Time to play, time to explore, time to waste, time to be curious. When we're young, we generally have health, we have energy, we have strength. But most of us don't have wealth. We don't have all the money in the world. We can't buy everything we want. We don't get everything we want. As we get older, we still have our health. It may not be the same, but it's still there. But we now have more wealth. We have more money. We have a home. We have devices and possessions. We have a car. We have access to things. But we don't always have time. Money can buy a house, but not a home. It can buy a bed, but not sleep. It can buy a book, but not knowledge. Money can earn a title, but not respect. It can buy a clock, but not time. Those of us who think we have no time for our health will sooner or later have to find time for our illness. When we're young, we have time and health, and no money. When we're older, we have money and health, but no time. And finally, in old age, we have money and time, but no health to use that well.
Sorry. That's well done.
And for insurance.
Turn on the time.
So what do? We can have it all, just not all at the same time. We place so much pressure on ourselves, trying to get everything to be perfect, trying to get everything to balance, trying to get everything to work together, not recognizing that it's none of those things that actually create happiness or fulfillment in life. As we get older, time, health, and wealth will all be taken away from us. But the one thing that can never be taken away from us is the impact we have on others, because it lives on through them. Our health is the foundation of how we can build our time and wealth. And with our time and wealth, there are two key principles. We become successful by what we get, but we become happy by what we give. And what we give includes our time, our wealth, our energy. And when those things are used to make a positive difference in the lives of others, to help others move forward, to make an impact, that legacy will never be taken away. And as Maya Angelou said, people will forget what you said. People will forget what you did. But people will never forget how you made them feel.
Usually for younger people, but I like it.
Even younger men.
Yeah, younger men maybe. Cool. That's all I've got.
That's pretty good.
Yeah. For today. I suppose I forgot to bring business cards. If you want to get in contact with me, maybe you can ask Chris. Is that the best? Oh, sorry, Chris. Can you pass on? Do you all on the email?
Yeah. To me.
I'll reply to your email.
Yep.
I'm happy if you call me. If you call me, give me a couple of days to get back to you sometimes. I will get back to you. You can email me, you can get on the internet, you can book online, you can do whatever. If you don't want to come over to Belconnen, or if you're in aged care, we can come to you. If you're over this side of town, I can put you in contact with someone else. Okay?
So Daniel, what's your clinics?
Accelerate Rehab.
Accelerate.
Spelt funny, ACCELR with the number 8. Don't confuse it with Accelerate Physiotherapy. Accelerate Rehab.
Thank you so much, Daniel.
That's all right. Good fun.
Very, very informative. Did you ask?